Dear viewers and listeners, I greet you with the magnetic resonance imaging system, which is the subject of today's presentation. I will first inform you about how the device works and information about this device, and later I will give some information about the history of the device. I will explain also the usage areas, some usage areas of this device, and in which this uses it helps to open a new era in medicine with various pictures. Inside of the ingredients, we have information about the device. As a second term, we have history of MRI, and third one is usage of areas. As information about magnetic resonance imaging, it is a medical imaging technique used in radiology to form pictures of the anatomy and the physiological processes of the body. MRI scanners use strong magnetic fields, magnetic field gradients, and radio waves to generate images of the organs in the body. MRI does not involve X-rays, which is actually really most important and one of the which makes this device one of the best imaging system in the world, or the use of ionizing radiation, which distinguishes it from CT and PET scans. MRI is a medical application of nuclear magnetic resonance, which can also be used for imaging in other NMR applications, such as an NMR spectroscopy. MRI is widely used in hospital and clinics for medical diagnosis, staging, and follow-up disease. Compared to CT, MRI provides better contrast in images of soft tissues, for example in the brain or abdomen. However, it may be perceived as less comfortable by patients due to the usually longer and louder measurements with the subject in a long and confining tube. Additionally, implants and other non-renewable metal in the body can pose a risk and may exclude some patients from undergoing an MRI examination safely. MRI was originally called nuclear magnetic resonance imaging, but nuclear was dropped to avoid negative associations. Certain atomic nuclei are able to absorb radio frequency energy when placed in an external magnetic field. The resulting evolving spin polarization can induce a RF signal in a radio frequency coil and thereby be detected. In clinical and research MRI, hydrogen atoms are most often used to generate a macroscopic polarization that is detected by antenna close to the subject being examined. Hydrogen atoms are naturally abundant in humans and other biological organisms, particularly in water and fat. For this reason, most MRI scans essentially map the location of water and fat in the body. Pulses of radio waves excite the nuclear spin energy transition, and magnetic field gradients localize the polarization in space. By varying the parameters of the pulse sequence, different contrast may be generated between tissues based on the relaxation properties of the hydrogen atoms therein. Since its development in the 1970s and 1980s, MRI has proven to be a versatile imaging technique. While MRI is prominently used in diagnostic medicine and biomedical research, it also may be used to form images of non-living objects such as mummies. Diffusion MRI and functionally MRI extends the utility of MRI to capture neuronal tracts and blood flow respectively in the nervous system. In addition to detailed spatial images, the sustained increase in demand for MRI within health systems has led to concerns about cost and effectiveness and overdiagnosis. The mechanism is quite complicated actually. This device has the following mechanism in most medical applications: hydrogen nuclei, which consists solely of a protein that are in tissues, create a signal that is processed to form an image of the body in terms of the density of those nuclei in a specific region. Given that the proteins are affected by fields from other atoms to which they are bound, it is possible to separate responses from hydrogen in specific compounds. To perform a study, the person is positioned with an MRI scanner that forms a strong magnetic field around the area to be imaged. First, energy from an oscillating magnetic field is temporarily applied to the patient at the appropriate resonance frequency. Scanning with X and Y gradient coils causes a selected region of the patient to experience the exact magnetic field required for the energy to be absorbed. The atoms are excited by a radio frequency pulse, and the resultant signal is measured by a receiving coil. The RF signal might be processed to deduce position information by looking at the changes in RF level and phase caused by varying the local magnetic field using gradient coils. As these coils are rapidly switched during the excitation and response to perform a moving line scan, they create the characteristic repetitive noise of an MRI scan as the windings move slightly due to the magnetostriction. The contrast between different tissues is determined by the rate at which excited atoms return to the equilibrium state. Exogenous contrast agents may be given to the person to make the image clearer. About the history of this MRI would be in 1971 at Stony Brook University, Paul Leitherbauer applied magnetic field gradients in all three dimensions and a back projection technique to create an MRI at the University Stony Brook, as we see here in the picture. He published the first images of two tubes of water in 1973 in the journal Nature, followed by the picture of a living animal, a clam, and in 1974 by the image of the thoracic cavity of a mouse. Leitherbauer called his imaging method sogmatography, a term which was replaced by NMR imaging. In the late 1970s, physicists Peter Mansfield and Paul Leitherbauer developed MRI-related techniques, like the echoplanar imaging EPI technique. Advances in semiconductor technology were critical to the development of practical MRI, which requires a large amount of computational power. This was made possible by the rapidly increasing number of transistors on a single integrated circuit chip. Mansfield and Leitherbauer they were awarded the 2003 Nobel Prize in Physiology for Medicine for their discoveries concerning magnetic resonance imaging. Usage areas of this device would be, I will show you some of the usage areas. This device is important in image transfer in organs and systems such as neurology, cardiovascular field, angiosystems. MRI has a wide range of applications in medical diagnosis, and more than 25,000 scanners are estimated to be used worldwide. MRI affects diagnosis and treatment in many specialties, although the effect on improved health outcomes is disputed in certain cases. MRI is the investigation of choice in the preparative staging of rectal and prostate cancer and has a role in the diagnosis, staging, and follow-up of the tumors, as well as for determining areas of the tissue for sampling in biobanking. As we see here, for example, on the left side we see the diagnosis, the imagination of the diagnosis from the MRI device, and on the right side we are seeing the neurological areas of the brain according to MRI scanners from a patient. And in this presentation, as you heard, the importance and history of the device imaging systems were discussed. I hope that I have conveyed the necessary information about the device to you, and I thank you.